Do you sometimes find yourself getting unusually tired after doing something you used to do easily, like gardening or walking around the block? Maybe you blame it on just getting older, or perhaps you've noticed a slight breathlessness doing simple chores around the house, thinking it's nothing serious. Millions of us in our golden years experience little aches, pains, and changes, and it's natural to dismiss them. We think, well, that's just how it is now. But what if some of these seemingly minor things are actually signals your body is sending, signals you absolutely need to understand? Today, we're going to talk about a health topic that might sound a bit formal: coronary artery disease, or CAD, but we're going to talk about it in a simple, straightforward way, focusing on some often missed signs. Think of it as understanding your heart's quiet whispers before they become shouts. It's not about complicated medical jargon. It's about paying attention to what feels different and important. You see, dismissing these changes as just part of aging isn't harmless. Over time, ignoring these subtle signs related to your heart can gradually take away your independence, make simple tasks feel overwhelming, lead to constant worry, and significantly impact your quality of life and time with loved ones. It's not just about feeling tired. It's about potentially losing the energy and freedom to do the things you cherish. You might think these changes are an inevitable part of getting older, but the truth is, they could be pointing to something manageable if caught early. In this video, I'm going to reveal 6 crucial signs of coronary artery disease that are often overlooked in older adults. These aren't necessarily the dramatic chest clutching symptoms you see in movies. They are subtle, sometimes confusing, but incredibly important indicators you need to know. Paying attention to these 6 signs could make a world of difference in staying healthy, active, and independent for years to come. Before we dive deep into these important signs, if you also believe that staying informed about your health is key to enjoying your later years, please go ahead and hit that like button right now. And if you haven't already, make sure you subscribe to the channel and ring the notification bell so you don't miss out on future helpful health tips. All right, let's start with the very first sign that's often mistaken for just typical aging. Sign number 1 that you really shouldn't ignore is unusual or extreme fatigue. Now, everyone gets tired, right? But this isn't just feeling a bit weary at the end of the day. This is feeling completely drained, often out of proportion to what you've actually done. Why might this happen? When your heart's arteries are narrowed by plaque that's CAD, your heart has to work much harder to pump blood and oxygen throughout your body. This extra effort can simply exhaust your system, even with minimal activity. I saw this firsthand with my friend Mary, who was in her late 70s. Mary was always active, loved her garden, and played bridge weekly. But slowly, she started canceling bridge games. She stopped gardening, saying she just didn't have the energy to even walk to the shed. She brushed it off as just getting old. Her family noticed and gently encouraged her to see her doctor. After some tests, they found significant blockages in her coronary arteries. It wasn't just age, it was her heart struggling. Once she received treatment, her energy levels significantly improved, and she's back to her bridge club and tending to her beloved roses, albeit maybe a bit slower than before, but with joy and energy again. Ignoring this kind of fatigue can mean missing out on simple pleasures and important social connections, the things that make life rich. It can limit your ability to get groceries, visit friends, or even just enjoy a walk in the park. It doesn't just affect your energy, it affects your entire way of life. If you or a loved one are experiencing fatigue that feels way beyond what's normal for your activity level, please pay attention. Now, let's look at a sign that often happens during activity. Sign number 2 is shortness of breath, especially during mild activity. Again, getting a little breathless after climbing a few flights of stairs might be normal. But this is about feeling significantly winded after very light effort, like walking across a room, getting dressed, or even just talking on the phone. When your heart isn't getting enough blood flow because of narrowed arteries, it can't efficiently deliver oxygen to your muscles and organs, including your lungs. This lack of oxygen can manifest as that distressing feeling of not being able to catch your breath. My neighbor, Mr. James, a gentleman in his early 80s, experienced this. He loved his morning paper, but suddenly found himself stopping halfway down his short driveway, leaning against a tree, just to catch his breath after picking it up. He initially thought he was just out of shape, but the breathlessness got worse, happening even when he stood up from a chair. His daughter insisted he see a doctor, and it turned out he had advanced CAD. Getting diagnosed and treated made a huge difference. He can now comfortably walk to the mailbox and back, and even take short strolls around his yard without gasping for air. Shortness of breath can be frightening and quickly limit your mobility and confidence. It can make you scared to leave the house or participate in activities you once enjoyed, isolating you and diminishing your world. Don't dismiss new or worsening breathlessness during simple activities. It's a strong signal that needs evaluation. This next sign can be particularly tricky because it doesn't always feel like what you'd expect. Sign number 3 is chest discomfort that doesn't feel like the classic heart attack pain. We often picture heart pain as a crushing pressure in the chest, and it can be. But in older adults, especially women, symptoms can be much more subtle or different. It might feel like indigestion, heartburn, a tightness, a fullness, or even just discomfort. This happens because when blood flow is restricted, the heart muscle doesn't get enough oxygen, causing a type of pain or discomfort called angina. The way our nerves register this can vary greatly. I remember hearing about Mrs. Susan, a vibrant woman in her late 60s. She started complaining of what felt like terrible heartburn, especially after dinner or if she walked uphill. Antacids didn't help. Her family physician suspected reflux, but decided to run some heart tests because of her age and other risk factors. To everyone's surprise, she had significant blockages. It wasn't indigestion at all. It was her heart crying out for oxygen. Getting the right diagnosis and treatment meant her heartburn disappeared, and she avoided a potentially serious event. Dismissing chest discomfort as just gas or heartburn is incredibly common, but it can mean missing a critical warning sign. It can lead to unnecessary suffering or, worse, a serious cardiac event that could have been prevented. Any new or unusual discomfort in your chest area, even if it feels like indigestion or pressure, especially if it happens with exertion, needs to be checked by a doctor. Don't try to tough it out or self-treat. Sometimes the warning signals show up in other parts of your body. Sign number 4 is discomfort or pain that radiates to areas other than the chest, like the arms, jaw, neck, or back. This is another instance where the body's wiring can be a bit confusing. When the heart muscle is deprived of oxygen, the pain signals can travel along nerves that also supply the arms, jaw, neck, and back. Your brain gets confused and interprets the pain as coming from these other areas, even though the problem is originating in your heart. This is why people might complain of a toothache, a stiff neck, or an ache in their arm off in the left, but can be either when their heart is the actual issue. My friend Bill, a retired carpenter, started having this persistent ache in his left shoulder and jaw. He thought he'd slept funny or strained something while woodworking. He even saw a chiropractor who couldn't find anything wrong structurally. It wasn't until the pain started happening regularly whenever he walked up a slight incline that his wife remembered reading about heart symptoms presenting this way. They went to the doctor, and yes, it was his heart. Getting the blockages addressed relieved the strange aches that had been puzzling him for months. Pain in these areas can be easily attributed to arthritis, muscle strain, or other common ailments of aging. Overlooking them as potential heart signals means missing a crucial window for intervention that could prevent a heart attack or other serious consequences. If you have new, unexplained discomfort or pain in your arms, jaw, neck, or back, especially if it's triggered by physical activity or stress, mention it to your doctor and specifically ask if it could be heart-related. Here's a sign that might seem completely unrelated, but can be a red flag. Sign number 5 is swelling in your legs, ankles, or feet, also known as edema. While swelling in the lower extremities can have many causes, including circulatory problems or kidney issues, it can also be a sign that your heart isn't pumping as effectively as it should. When the heart is weakened, which can happen over time with untreated CAD, it struggles to return blood from the lower body back up to the chest. This can cause fluid to build up in the legs, ankles, and feet due to gravity. Nancy, who lives down the street, noticed her ankles were constantly swollen, especially by the end of the day. Her shoes felt tight. She used to joke about cankles. She tried elevating her legs, which helped a little, but the swelling never fully went away. When she finally brought it up to her doctor during a routine checkup, along with feeling a bit more tired, tests revealed her heart function was reduced due to long-standing, undiagnosed CAD. Addressing the heart problem helped manage the swelling, making her much more comfortable and reducing other risks. Persistent swelling isn't just uncomfortable. It can make walking difficult, increase the risk of skin problems, and significantly impact your mobility and quality of life. More importantly, when related to heart issues, it indicates a more advanced problem that needs immediate attention. Don't ignore new or worsening swelling in your lower legs or ankles. While it might be something simple, it's essential to get it checked out by your doctor to rule out heart issues and other serious conditions. And finally, here's a sign that can be particularly alarming and needs immediate attention. Sign number 6 is feeling dizzy, lightheaded, or even fainting. Dizziness can stem from various causes in older adults, including medication side effects or inner ear problems. However, it can also be a signal that your brain isn't receiving enough blood flow. When coronary arteries are significantly narrowed, the heart's ability to pump blood, especially to the brain when you stand up or exert yourself, can be compromised. This reduced blood flow to the brain causes those feelings of lightheadedness or dizziness. Just last year, my friend's uncle, Mr. George, had a couple of dizzy spells. The first time, he was just getting up from his chair. He felt woozy but shook it off. The second time, he almost fell. His family was very concerned. He went to the doctor, and during the evaluation, they found significant blockages affecting the blood flow to his brain when his heart was under even slight strain. Getting appropriate cardiac care immediately stabilized his condition and eliminated the dangerous dizziness. Dizziness and lightheadedness are not just uncomfortable. They dramatically increase the risk of dangerous falls, which can lead to fractures and a significant decline in health and independence for older adults. Ignoring this symptom related to heart issues is incredibly risky. Any new episodes of dizziness, lightheadedness, or feeling like you might faint, especially if they occur with activity, are serious and require prompt medical evaluation to determine the cause, including checking for potential heart problems. Recognizing these signs is the first step. The next is taking action. What does that mean practically? It means scheduling an appointment with your primary care doctor as soon as possible to discuss your symptoms. Be clear and specific about what you've been experiencing: the fatigue, the breathlessness, where you feel discomfort when it happens, and how long it lasts. Don't downplay anything. Write it down beforehand if that helps. One of the biggest mistakes you can make is assuming these symptoms are just old age and doing nothing. Another is self-diagnosing or hoping it will just go away. It's also a mistake to delay seeking help because you don't want to be a bother. Your health is important, and doctors are there to help you figure out what's going on. Remember that symptoms can vary. Some people might have one sign, others might have several, and the severity can differ. The key is paying attention to new changes or worsening of existing symptoms. This is critical. This video provides general information, but it is not a substitute for professional medical advice. You must consult with your doctor or a healthcare professional if you have any concerns about your health or experience any of these signs. They can properly evaluate your situation, run necessary tests, and provide a diagnosis and treatment plan tailored to you. So we've covered 6 signs: unusual fatigue, shortness of breath with mild exertion, atypical chest discomfort, pain in other areas like arms or jaw, swelling, and dizziness. Paying attention to these subtle signals is about much more than just a medical condition. It's about protecting your health, maintaining your independence, and continuing to enjoy life to the fullest. Understanding these signs isn't complicated. It's about being aware of your body and trusting yourself when something doesn't feel right. The actionable step is simple: talk to your doctor. I know it can be unsettling to think about these things, and it's easy to rationalize symptoms away. But ignoring these small signs can, unfortunately, lead to bigger, more serious problems down the road, problems that could have been prevented or managed more easily if caught earlier. It's about avoiding unnecessary struggles and keeping your freedom. But here's the empowering truth: you have the power to take charge of your health. You are not powerless against aging or potential health issues. By being informed and taking action, you are choosing to prioritize your well being. It's never too late to start paying closer attention and advocating for yourself. You have the right to feel your best and to live your later years with as much vitality and independence as possible. As you've seen, recognizing the subtle signs of coronary artery disease in older adults isn't just about identifying a potential illness. It's about safeguarding your quality of life. It's about having the energy to play with your grandchildren, the breath to enjoy a walk in nature, and the peace of mind to live without constant worry. It's about preserving your independence and continuing to be an active, vibrant part of your family and community. After watching this video, which of these signs surprised you the most? Or perhaps you have a question about one of them. Please share your thoughts and questions in the comments section below. I'd love to hear from you and try to help where I can, or at least learn from your experiences. If you found this information helpful and valuable, please show your support by giving this video a thumbs up. Hitting that like button really helps us reach more people. And if you haven't joined our community yet, please subscribe and turn on notifications so you don't miss our future health discussions. Most importantly, if you know someone, a parent, grandparent, friend, or neighbor who is an older adult or cares for one, please consider sharing this video with them. These subtle signs are often missed, and this information could genuinely make a difference in their life, encouraging them to seek help early. Sharing this video is an act of care. Thank you so much for watching and for taking the time to invest in your health or the health of someone you care about. I wish you and your loved ones continued health, happiness, and vibrant years ahead. Take care of yourselves, listen to your bodies, and I'll see you in the next video.